I'm Orru, I'm from University of Tartu. In this video I will talk about air quality. Air quality is very important for public health because we are inhaling every day different pollutants, and if they come into our organism, a lot of people can be affected. To get to know how much air pollution affects health, one of the options is having different health impact assessment. According to this, only in Europe, hundreds of thousands of people actually die prematurely every year because of the bad air quality. The mechanism how air quality affects our health, that first we are inhaling different pollutants. One of them especially important are particles. Some particles are larger, they are called particulate matter, but some of the particles are smaller, like fine particles, and also ultrafine particles. So first they reach respiratory system, so they can affect our respiratory health. But some of those are going to the cardiovascular system, and then they can translocate it into different organs. Some of the particles are small, as they can also reach your brain. So we are talking about different cardiovascular diseases, different inflammatory diseases, diabetes, also neurodegenerative diseases. A few years ago, we set the concept of interplay of climate change and health and air quality. What does it mean? In this picture, you can see that on one side, we have a climate change. On the other side, we have air quality. On the third side, we have also health and related topics as nutrition, food, and etc. All those are very important to the public health. And the connections can be vice versa. For instance, climate change can affect air quality, but also air pollution can affect climate change. When we do see different pollutants as the sources, some of the pollutants are called primary pollutants, though they are kind of coming to different sources. For instance, if we're burning something, if we have fires, if we're driving cars, there is an exhaust, and those are primary pollutants. Some of those primary pollutants are also called short-lived climate pollutants. That means we have factors that affect climate change in a large scale, like it takes decades to change something. But some of those, as a soot, they can have a quite quick effect. What soot does? It's kind of dark thing, and the darker the atmosphere is, the more heat it does absorb. So if we will have less those primary pollutants, for instance the soot, the atmosphere would be a bit lighter, and then it would absorb a bit less light. So it's especially important to decrease those emissions of short-lived climate pollutants. Another very important factor for the air quality is how different pollutants are dispersed. So if we have windy conditions, it's a good dispersion conditions. But if the atmosphere is very stable, especially if there are different layers in the atmosphere, sometimes the pollution doesn't go nowhere. And those periods are also called inversion periods. And that time, if we're emitting constantly new pollution, it just stays in our environment. And then one moment we will have extremely high concentrations. Some of the models predict that during the climate change, we might sometimes have more often this kind of inversion periods, and they might last longer. Another pollutant where climate has a big role is ozone. Sometimes we say that there are good ozone and bad ozone. Good ozone is an ozone layer. That's around 15-25 kilometers above us and protects us from the UV radiation. That's bad because it can cause skin cancer. That's why it's important to have it. But if it's near the surface, then we can inhale it, and then it comes our respiratory tract, also induce inflammation, and that's really bad for our health. Ozone is formed in phytochemical processes. That means if we have different primary pollutants, as we have nitrogen oxides, as we have volatile organic compounds, and then we have a lot of sunlight, then in these chemical processes, ozone is formed. With the climate change, especially during the summer and heat waves, we expect having higher temperatures, and more ozone will be formed. With climate change, we are expecting higher CO2 concentrations. Sometimes we are not that happy with that, but plants are very happy because plants like CO2. They grow better. If the temperatures are higher, there are more CO2, the pollen emissions will increase. Also, there are models that say that pollen season starts already earlier. We have seen very early springs recently. That means many of the plants start blooming earlier, already in March. There are around 10 to 15% of population that are allergic to pollen. So that's very important to take into account. Also, the climate change, the environment where we're living is changing. And that means that we might have new species. One of the plants that induce allergy is ragweed. And currently, it's not that much spread in Northern Europe, but by the end of this century, it also might reach the northern areas in Europe. If you think about cities and urban areas, it's important what do we plant there. If you compare birch to other trees, birch is much more allergic than the others. So in urban planning, urban vegetation, it's important to think about what kind of plants will be there in 50 years. Taking all this, especially the numbers that hundreds of thousands of people are dying each year globally because of the air quality. And with the climate change, this situation might even get worse. So it's important to take already now the measures to improve the air quality worldwide. To conclude these messages, air quality has a vital role in public health. Climate change can affect air quality through the worse dispersion conditions, more ozone formation, and vice versa. Worse air quality can make climate change even worse. Thank you.